Good morning and welcome to the first session today. I'm Allison Aiello, Professor of Epidemiology at the UNC Gillings School of Global Public Health, and I'll be moderating this morning's session on the history, narrative, and context of the 1918 influenza pandemic. Over the next 70 minutes, we'll take a look at this pandemic through both regional and worldwide lenses and discuss narrative frames and contagion. So without further ado, I will take this moment to introduce our three esteemed speakers in the order that they will take the podium. I'm delighted to introduce our first speaker, Dr. Howard Markel. Dr. Markel will start us off with a presentation on the origin, scope, and impact of one of the largest, deadliest pandemics in history. Dr. Markel is the George E. Wantz Distinguished Professor of the History of Medicine and Director of the Center for the History of Medicine at the University of Michigan Medical School. He is also Professor of Pediatric Psychiatry, Health Management and Policy, History, and English Literature and Language. Dr. Markel consults to the CDC on pandemic preparedness, and his work has helped shape pre-pandemic planning guidelines. I'm also delighted to introduce Dr. Priscilla Wald. Dr. Wald will discuss how narrative frames shape our collective response to pandemics. Dr. Wald is the R. Florence Brinkley Chair of English and Margaret Taylor Smith Director of the Program in Gender, Sexuality, and Feminist Studies at Duke University. She is the author of Contagion: Cultures, Carriers, and the Outbreak Narrative. Dr. Wald serves on the board of the Center for the Humanities and Medicine at Hong Kong University. She is currently working on a monograph entitled Human Being After Genocide. Her aforementioned book, Contagion, provides a very interesting and relevant context and lens by which to examine historic pandemics. Finally, I'm excited to introduce Dr. James Leloudis. Dr. Leloudis will describe the historical context of the 1918 flu pandemic in North Carolina and the South. Dr. Leloudis is Professor of History, Peter T. Grauer Associate Dean for Honors, and Director of the James Johnston Center for Undergraduate Excellence at UNC-Chapel Hill. He is the author of Schooling the New South: Pedagogy, Self, and Society in North Carolina, 1880 to 1920, and co-author of Like a Family, The Making of a Southern Cotton Mill World. He is currently working on a history of voting rights and a project on the moral challenges of poverty and the ethics of service. Because our agenda is very full today, there is not time to do justice to these very three accomplished speakers. You can find more information on our speakers, and I encourage you to look at this information online in the program. I'd also like to mention that we will have time for questions at the end of all three presentations. So please join me in a warm welcome for our first speaker, Dr. Howard Markel.
Thank you. I've got a timer. So we're going to talk everything about flu in 29 minutes and 53, 52, 51 seconds. You know, I was thinking on the long plane ride here, because I was on the tarmac for 3 hours. The delay was longer than the flight. And what could I say? You know, the first speaker on a wonderful conference on celebrating the 100th anniversary of the 1918 flu pandemic. Yay. I don't know what to say. What I thought I would talk about today is helping you, if you would like to find out more about the flu epidemic, helping you to research it yourself because of the research that my colleagues and I did at the University of Michigan in collaboration with the Centers for Disease Control, particularly the Division of Global Migration and Quarantine, as well as a number of other scholars around the country. Even though it says global perspective, I'm an American historian, so I'm going to limit it to the 48 states that were the United States back in 1918 a little bit. But we have developed, which you can find online, and I'll give you the address in a moment, a digital encyclopedia of all things flu, basically, in the United States during 1918. First, a few facts. Dean Reimer already gave most of my lecture, so I don't have to give it. But you know, the experience in 1918, from about September 1st to April 5th, 1919, there were about 10 million cases and 500,000 flu deaths. Now, sometimes the number goes as high as 650,000 flu deaths. We don't really know the precise number. But worldwide, there were hundreds of millions of cases and at least 50 million flu deaths around the world. Now, in some parts of the world, in fact, in some parts of the nation, the case fatality rate was as high as 10 or 11%, which is astounding. Overall, we give about 2 to 2.5%, which is still astounding because in a regular flu, seasonal flu epidemic, it's about 0.01%. So 2% case fatality rate is quite high, even for something that we know is deadly every time it comes around. There were approximately 3 waves of the flu pandemic. There was the spring, summer, which was somewhat mild in 1918, the fall of 1918, then a brief rest, and then the winter of 1919. There was actually another wave in 1920, in the winter of 1920, which if the first 3 waves didn't happen, we'd be talking about that because it was fairly significant. But we tend not to, and that's part of the story, too, that we've been working on it in Ann Arbor. And of course, you've seen these curves. There's a traditional U-shaped curve for flu deaths, the very, very young, infants particularly, and the very elderly for other reasons, but both have immunological issues when facing the challenge of true influenza. They tend to be the deaths in a seasonal flu pandemic. What was remarkable in 1918 was this W-shaped curve, the bold curve, that you saw young people between 25 and 45 years of age succumbing to flu and dying. And of course, as Dean Reimer mentioned, and most of you know, 1918 had another worldwide event going on. We now refer to it as World War I. It was called the Great War at the time, and for the European nations involved, they were already involved in it for 4 years. But in 1918, the United States became involved as well. So you had this great mobilization of men, 4 million American soldiers from all around the United States with different immunological backgrounds, all of a sudden cramped into tight camps in tents, digging their own latrines, not necessarily having adequate water to bathe or wash their hands before meals or wash their utensils and so on. And you can imagine what that would do as an amplifier of a terrible viral epidemic. I love these are human people. There was a photographer named Arthur Mold who used to take all these pictures of soldiers shaped like the Liberty Bell or the Declaration of Independence. I love this because it's Woodrow Wilson, and I show a close-up. Look at all those soldiers in Woodrow Wilson's nose, which of course is a new risk factor for contracting influenza. And of course, you can see in these wave curves in 1918, the mortality rates for during the 1890 epidemic, that's the lower wave, the civilian rate for 1918 cities, which is pretty high, and look how high it is in U.S. Army camps because of the overcrowding and so on. Well, let me give you a little bit of background about the project. We were asked by the CDC many years ago now, almost 10 years ago, to study non-pharmaceutical interventions during the 1918 pandemic. Now, that's what modern public health workers call what historians refer to as quarantine, school closures, or public gathering bans. Now, we looked at those because there was a clear lever of when they were turned on and when they were turned off. And to be honest, even though I've been a historian of quarantine, which is a very lonely job, by the way, except when there's a pandemic and that your business is quite booming. But no one had really ever studied, do these methods work? Quarantine, of course, comes from an Italian edict in the 1370s in Venice, quarantina, quarantinaria, quarante giorno, 40 days. And it was a response to plague pandemics in the port of Venice. Now, that 40 days was probably considered the time that it would burn itself out, but ever since, quarantine has been refined and fine-tuned depending on the disease it was applied to, and not always applied very well. In fact, a lot of my own work was the social purposes or misuses of quarantine, particularly for stigmatized groups such as minorities and immigrants. But does quarantine actually, is it an effective tool? And no one had really done a quantitative study. And we did this in looking at 43 cities in America, and we found that things like quarantine and school closure, and to some extent public gathering bans, can be effective in preventing flu from spreading in a particular town if they're done early enough, because you have to do it before flu starts spreading all over, if they are layered, more than one done at the same time, and done for a long period of time. Those cities enjoyed a lower mortality and morbidity against flu in 1918, those American cities, than those that did not. Now, you have to, these are very expensive socially and economically expensive measures to take, so you would only take them in a pandemic where you had a high case fatality rate. You would not do them necessarily, say, in a seasonal flu epidemic when there aren't that many people dying from it. And we looked at how they worked and why they were implemented. If you want the study, it was in, gosh, I can't even remember now. I think it was August of 2007, but I have a warehouse full of reprints that I can give you, as well as copies of my books. So, now, we had all of this data that we had gathered for this study. We had papers and newspaper accounts, and I'll give you a better survey of that in a moment. And they were all in file cabinets in the basement of our historical center for history of medicine at University of Michigan. And I thought, well, gee, why should anyone have to recollect all this stuff? And there are many other uses beyond the study we published in JAMA in 2007 that may be of great use, both to historians or people who study the narrative of Contagion, or more germane to many of the people in this room. What could you do with this data? Because it's the first pandemic in the post-germ theory era that somewhat makes sense. It has somewhat the similar terms and technologies, albeit not entirely, to modern day. Could you use these for other studies? And it seemed to me to be an incredible waste of material. So my first thought, and I can see there's a lot of gray hair in the room, and I have a lot more gray hair than I used to, like even yesterday it seems. But I thought immediately of an encyclopedia. Right? Because you could put many volumes together and you could put all this data and reprint it and so on. Well, I contacted my publishers at Random House and they would have none of it. And then I called Scribner's, which publishes a lot of encyclopedias, and they said, we're really not doing that anymore. And I talked to a previous publisher at Johns Hopkins University Press, and they were kind of interested, but only if I wrote a shorter book on influenza. There's too many damn books on influenza, so I didn't want to write that. And then talked to a few others, and finally we met with publishers at the University of Michigan. It was actually at a party, and they were going digital at the time. And the University of Michigan Publishing Press said, why don't we talk about a digital encyclopedia? And then a light bulb went on in my head, you know, and it was actually turned on by my then 7-year-old daughter, that, you know, there are all these forms of information that could be far better presented in a digital format than you could ever do it in an encyclopedia. Because you could do, for example, a qualitative study of each of these cities. I call them biographies of these cities. But with each reference, you could have a hyperlink, and then the reader could see what we were saying, what we were basing it on. Is that document fair? Is it a fair interpretation of it? Might they use that document in a different way? So this became very exciting to me as an educator and as a historian. We now have about 60 American cities biographies on the site. So we worked with digital archivists and digital librarians. I won't bore you with the details. They're incredibly important. I understand none of them. And they had to work very hard to give each document, we have some, 20,000, 16 or 20,000 individual pieces of paper, that each had to have its own digital code. It had to be digitized properly. It had to have a certain platform. This kind of stuff is really important, and it's constantly being worked on and changed. In fact, it's being worked on right now as I speak. So we have interpretive content. There are narrative essays that serve as the foundation. These are what these biographies of these cities. We have timelines. People love timelines, and they're a very handy way to look at a particular event for the epidemic period. It's very rich with images, photographs, postcards. By the way, if you really want to learn a lot about America, for example, between 1900 and 1930, go to eBay and look up for postcards on that time. It's incredible what people put on postcards. I mean, photographs of, like my house or something like that would be on a postcard. And of course, the web is the perfect medium for this because it's interactive by nature. All of our materials that are noted in footnotes are accessible, and it's ever expandable. We keep expanding it as more material comes in. So the digital archive, it has the interpretive site backed by a robust digital archive, and our entire collection of materials has been in there. This says over 16,000 documents, including tens of thousands of pages and counting. We just put out a 2.0 a few months ago. That was from 1.0, and there's now about 25,000 documents online, including a lot of the secondary literature that we are gathering from 1918. On the flu pandemic, going all the way to the 1930s, and including textbooks that there may be one copy of at one library that is now online and available. The newspapers, we collected, and we went to the Library of Congress to do this, but for our 43 cities, and then we've expanded it, 2 newspapers per city, day by day, from September 1st to about April 1st, September 1st, 1918 to April 1st of 1919. 2 newspapers because most newspapers were organs of this party or that party, so they tended to be the Democratic organ or the Republican organ, and how the public health agencies were doing in a particular city, as reported by that newspaper, depended a lot on who was in power and what the organ was. But we did that, and we have this great coverage, and we're still expanding that to this very day. So people can actually read the newspaper accounts, and it's wonderful. It's just wonderful stuff. This is what I call the Rosetta Stone of studying the flu pandemic in terms of quantitatively. The U.S. Census Bureau Weekly Health Index. And there were very few copies of this. We knew it existed, but we thought, well, we'll go to the National Archives. It's missing. Well, then we'll go to the U.S. Census Bureau, their library. It was missing. And then I was playing around in the New York Public Library, which is one of my favorite places on earth. And I decided, well, I'm going to look it up there because they have almost everything. It's the second largest library in the world. And lo and behold, they had a microfilm copy because Franklin Delano Roosevelt's WPA project called for the microfilming of government papers for future historians. And this just happened to be one of them. It's the only copy. Well, now it's online. And you can have, that's why we picked 43 cities, by the way. There are 43 cities that it gives week-by-week mortality and morbidity data for diseases like influenza and pneumonia. In a flu pandemic, if it's a death from influenza/pneumonia, we decided that's most likely influenza. There are no cultures at that time. Viruses aren't understood. It's about as good a piece of data we're going to get. And it's not every individual city. Now, we can get from mortality and morbidity data from each city's health department, but it's not unified. And this was collected by one group, so we thought that would be the best way to compare and contrast. That goes all the way to June 1919, by the way. But we do have municipal health reports from 50 cities, annual reports from actually now every state, monthly and weekly bulletins when they were available, and other departmental reports. Most public health departments in that day were very robust in what they published, and so they're all available. Now, they were only available in one library, the New York Academy of Medicine, and the former president was a friend of mine. I called him, and finally, after a bribe of a great many dinners and some fees, we were able to get all that digitized as well. But as I said, articles from the medical, nursing, and public health journals, military and federal health reports, Red Cross stuff. Red Cross reports and nursing reports are really wonderful sources, and key secondary sources, as I mentioned. And we've also gotten a great deal of letters and personal materials. We visited over 130 different archives, collections, libraries, and historical societies. And some of the correspondence that we have been collecting and are continuing to collect, because people send us stuff now, is adding to the richness of the story of the flu pandemic and allows us to tell a better story for not just certain types of people, but minority groups, immigrant groups, and so on. We're collecting the immigrant press as well, the Yiddish press, the German press, the Italian press, and we're working on translating those because they tell very different stories often and tell us about the weaknesses of, say, the collection of data and the treatment of people during these crises. It's multimedia, photographs, political cartoons, maps, posters. We even found songs. I love this, the Influenza Blues, that's one of them. We found that in the British Library. I mean, it's an American song. And so if you're interested, it's www.influenzaarchives.org. And it's actually archives.org, not archive. I did that incorrectly. And if you're interested, let me know and we can get you information. But have at it. Search, enjoy, celebrate the 1918 flu pandemic in the way that historians do by covering themselves with dust and looking at old paper and reading other people's mail. Now, there are quite... I added some slides about Detroit, but I see, well, I have 11 minutes. Oh, I can talk. So I didn't realize that. So I figured I'd put some stuff about my own hometown. Just to give you an example, I was looking this up in preparation, so I wanted to look up a little bit about Detroit. And, you know, we found a great deal of information about James Inches, who was the Detroit commissioner at the time. He later became chief of police. I love that connection, you know, between health department and then later chief of police. And we collected all of his papers that were at the Detroit Historical Society, particularly those that pertained to flu, and some of the choice things he was saying about various people he was rounding up at the time. But we are also, as I mentioned, Red Cross material is really great, and it tells us a gendered story, because a lot of the American Red Cross Corps in 1918 were staffed by women, and they were professional women. Some were nurses, some were college-educated women who just wanted to help out, some were not college-educated women who were working on things like providing meals and bandages. But that, too, tells us a story that is not often told. And was very, very important. How they delivered supplies, what they saw when they came to these individual homes, and so on. Now, I love these crowding spaces. There are all these liberty parades during the worst pandemic ever. You know, it just boggles the mind. Now, some people wore masks, which Dr. Aiello knows a great deal more about the use or misuse of masks than I do, but trust me, they weren't used correctly, and they weren't the kind of masks that we think of today. They were basically gauze masks, and the best were a few layers. And of course, men were being mobilized and going off to war, and so that too was a great spread. And then there were women who were crying and being left behind to take care of their families. And so documenting the women left behind during the worst pandemic is another aspect that we've been working on, and what that was like for women who are managing homes, who are used to managing homes, but were now also managing finances and dealing with grave illnesses and perhaps the deaths of their children, or children who are dealing with the deaths of their moms and their dads as well. These are just the canteen. But we've got all this, not just photographs, but women who are keeping diaries and such of their work, which to me is just really, really neat and rich stuff. I love this because long before Rosie the Riveter in World War II, in 1918, there were plenty of American women who were working in factories. This is the Lincoln Motor Company, so if you are wealthy enough to drive a Lincoln, these are some of the people who made it, some of the women who made it. We've also been able to track African-American experiences with flu. This is a tougher nut to crack because there aren't a lot of archives that have kept the papers of African Americans unless they're very prominent people. But there are newspapers in almost every major American city that were primarily aimed at African Americans. So the Michigan Chronicle is the Detroit African American newspaper, the Baltimore Afro-American, the Amsterdam Star News, which is based in Harlem in New York City, and on and on and on. Philadelphia has one, Chicago has one. And so these have been recently collected by ProQuest, and so we have been adding those, the correct papers, the correct editions to our site as well. And of course, children, as a pediatrician, I find it these are very tough to document because kids don't leave a lot of diaries behind, but there's a lot of experiences in the schools of what the school children were taught and what they experienced, and of course medical inspection of schools, because there were almost every school district had pediatricians, not just nurses, but pediatricians assigned to investigate what was going on and to help treat them. We recently found the Washington Boulevard Gas Company's papers and how they got their, they had too many people coming in sick, so they sent them all home, and what their work policy was. And also the closure of theaters. This is right near, if you're a Detroiter, this is the Orpheum Theater. It's right near the Comerica Baseball Park, called the Gem Theater today in Detroit. And they had public performances that were closed, and we have posters and such to document that, as well as ads of telling people what they should do and combining one's public service as well as their patriotic service. It's not patriotic to give other people the flu. It isn't. I mean, I can't really argue with that. I also like, but it's also 100% common sense. I love that one too. So. And you know, gauze, and this was a huge thing about gauze masks. My favorite, I didn't put it in here, but we have San Francisco, which had the first mandatory mask law. And the mayor is seen, he's in a picture with his mask down here, not on his face, and I love that. But we got his papers too. That's a man named Ralph. And stores were closed early, and this had issues of commerce. And you know, what happens when you have to close like the malls or the department stores? These are far-reaching aspects of an epidemic or a pandemic. Got 5 minutes, I'm great, don't worry. You know, these are important things to think about, the economic impacts on what a true pandemic would do, and where would people go. And we were talking about, I see Dr. Gallen is in the audience when he was with the part of HHS. We had a lot of discussions back in 2005 and 2009. Where all the kids go if we close the schools? And people were worried they would all go to the malls. And I was kind of laughing in the back of the room because I knew back in 1918 they closed the mall. Well, they weren't malls, but they closed department stores. So, you know, where would people go? If you close one venue, would they go to another? And what would happen? It's an incredible set of social problems that we don't think about that often, and we need to. And we need to think about in advance of the actual emergency. And of course, you know, Army hospitals and soldiers were attacked by flu. More soldiers got various infections in World War I and died of infectious disease of all kinds than they died of bullets or cannon fodder. And, you know, Armistice Day, you know, there's a lot of people celebrating in Detroit. And of course, it's the birth of the Christmas seals starts with the 1918 flu pandemic. So it's a respiratory and tuberculosis kind of a thing today, but it really started with influenza. I always end my flu talk, some people have seen this slide before, but I end it with two things, actually. You know, no historian can provide a guarantee of things being deja vu all over again. It just doesn't work that way. But I think historical analysis can be helpful in informing contemporary pandemic preparedness in a variety of ways, from the qualitative to the quantitative. And I hope I've given you a flavor of that. And I think it's been very a wonderful experience as a historian of medicine to be involved in policy making over the last decade or more. And I think there's a lot of gold there that deserves to be mined. This is from the 1918 World Series. The Red Sox wearing a mask there. So there's a couple of masks, but I don't know which one is more protective. So, you know, in November 7th, 2005, I was in the National Archives, and I got paged because Time Magazine, a reporter from Time Magazine wanted to speak to me. And so, you know, professors will, yeah, I found when I was a working journalist, I found that people working for the government, well, you could get an aide who would come, not necessarily the principal. Head of companies would never talk to you. Professors, like that. We love to talk to the press. So I naturally got out of the archives and I picked up the phone. And the reporter was asking me, you know, the Yiddish expression was hocking your chinik, which is hitting your head. And he kept hocking my chinik by saying, how will the next flu pandemic unfold? How will it happen? And I said, you know, I don't really know. I mean, you know, it's the future, and historians are uncomfortable with the future by definition. And we just don't do that. We just don't. Oh, how will it? Well, come on. How? So you're a doctor, right? Yeah. So you make prognoses all the time, you know. And he's right. I mean, we make prognoses of the future. How long will a disease last, and so on. But I said, yeah, I don't want to. He said, come on. And I'm just, you know, I'm vamping, and I'm just saying, you know, fine, you know, no one really knows what's going to happen, and anyone who says they do is either an idiot or lying. And that's how I was quoted in Time Magazine. So I think I have 1 minute and 17 seconds left. I will yield that to the next speaker. I want to thank you so much for having me today. This is just a wonderful conference, and I look forward to the rest. Thank you very much.
So I'm going to start with a clip, and this is from the 2011 Steven Soderbergh, it's a trailer from the 2011 Steven Soderbergh film Contagion. Oh, we're supposed to get sound. Sorry, technical difficulties. Do we have sound?
The average person touches their face 3 to 5 times every waking minute. In between, we're touching doorknobs, water fountains, and each other.
Matt. No, go up to your room, honey.
So we have a virus with no treatment protocol and no vaccine at this time.
You had a seizure this morning, Beth.
Does she have a history of seizures?
No.
Allergies?
As of last night, there were 32 cases.
Unfortunately, she did die.
Right. Susan, can I go talk to her?
Mr. Amoff, your wife is dead.
What are you talking about?
Okay.
What happened to her? What happened to her?
Is there any way someone could weaponize the bird flu? Is that what we're looking at?
Someone doesn't have to weaponize the bird flu. The birds are doing that.
Watch this. It's transmission, so we just need to know which direction.
On day 1, there were 2 people, and then 4, and then 16. In 3 months, it's 1 billion. That's where we're headed.
They're calling out the National Guard. They're moving the president underground. People will panic.
Get away!
It will tip over.
The truth is being kept from the world.
Cook your samples, destroy everything. Hello. I need you to get me the names of everyone who serviced this room. It's an emergency.
You can't panic now.
I know.
I'm going to get you home. I got people too, Dr. Cheever. We all do.
Don't talk to anyone. Don't touch anyone. Stay away from other people.
Get back in your car. We're not sick.
It's figuring us out faster than we're figuring it out.
It's mutating. Which I don't think was a coincidence. How many of you saw the film? For those of you who didn't, you've just seen it. So the film is a classic example of something that I call an outbreak narrative, which is a conventional story with certain predictable features of an apocalyptic communicable disease that's threatening the human species. And my question that I want to start with is, why are we so obsessed with that story? We tell it over and over again in so many different forms. So that's where I want to start. And I think you could see, even from the trailer, that this story focuses a lot of our nebulous anxieties about globalization, specifically how social relations and human interactions are changing in a shrinking world. And I think you can see, even in the trailer, Gwyneth Paltrow, for example, is a mother and wife, and she has a high executive, like a very important job in a global corporation. It sends her around the world, and the question is, how is this going to affect, for example, her family? And she, of course, contracts a very deadly case of avian flu, brings it back, it does kill her son, and it seeds a pandemic that threatens the human species. So, here is this working mother who's a threat to the family and to the entire social structure. Unless you, wonder if she is in fact criminalized, there's a detail that you think is going to be important that has virtually nothing to do with the rest of the film, where she stops over in Chicago and has a little fling with a former boyfriend who's a congressman. That really has nothing to do with the rest of the film, but it certainly criminalizes her. But the outbreak narrative wouldn't work if it were only negative. And in fact, it relies on the appeal of contagion as well, which may sound counterintuitive, but I want to give you an example from the first two sentences of a global health sort of book. It's called The Politics of Global Health, and I'm sorry it got covered. Can I move that? Well, anyway, it's United by Contagion. So that sounds kind of counterintuitive. And it's also interesting to me that it's a textbook about global health, but in fact it immediately moves to contagion. And that happens all the time when people talk about global health. So the first sentence, health is the ultimate unifying issue for humankind. And notice it starts with health, but then the world is becoming an ever smaller place, and microbes that cause devastating diseases do not stop for border guards. So we're immediately into contagion. And there are two of the features, as you'll see, also of the outbreak narrative. The second sentence, and don't worry, I won't go sentence by sentence, but this is it. More and more, we are coming to understand that people with diseases located anywhere from down the street to the other side of the globe have important and varied impacts on our well-being. Health has become more than a medical issue. It's also a development issue, a commercial issue, a humanitarian issue, and a security issue. So notice how quickly contagion becomes the thing that we're looking at, and also it's something that unifies humankind, both because we all get sick, but also because in this alienating global world of ours, contagion tells us that we're also in contact with each other. So I think both of those things are operating in the outbreak narrative. So in the roughly 15 minutes that remain, I'm going to talk about what is the outbreak narrative. I'm going to show how it emerged, how it works, the consequences, and give you an alternative narrative. I'm going to talk really fast to do that, so wave at me if I'm going too fast. So what is the outbreak narrative? I want to begin with 2 points of reference. One is the Alma Ata Convention. How many of you know what that is? This is a really important moment in history that I think has been underplayed. And the Alma Ata Convention was sponsored by the World Health Organization and UNICEF. It took place in Alma-Ata at the time in the Soviet Union. There were delegates from 134 nations and more than 50 NGOs. And one of the things they did was adopt the UN definition of health as something more than the absence of disease, but actually it's about well-being, and it's a basic and fundamental human right. And what the signatories of the Alma-Ata Declaration agreed to was to work for universal access to primary health care by the year 2000. Well, we're obviously very far from that goal, but I think it was an important event. My other starting point is the starting point of the actual thing that I call the outbreak narrative, and that was a 1989 conference that was sponsored by the National Institute of Allergy and Infectious Disease, Rockefeller Institute and University, and the Fogarty International Center, where the term disease emergence or emerging infections really got coined and circulated. And the idea was communicable disease docs had been very sanguine in the mid-70s when, with the eradication of naturally occurring smallpox. And they said communicable disease as a threat is going to be a thing of the past. But of course, at that time, there were all kinds of very small outbreaks that were happening in various places, not getting a lot of attention, of hemorrhagic diseases like Ebola, Marburg, Bolivian hemorrhagic fever. But also HIV was beginning to make its horrific way around the globe. By 1989, their sanguinity was punctured, and these guys saw all of these infections as part of the same phenomenon, this phenomenon they called disease emergence, and they said, you know, and this is where they intersect, I think, with the Alma-Ata Declaration, we have to see health, we have to see this problem as something more than a medical and scientific problem. We have to address it as a social and geopolitical problem. It involves globalization and development patterns. The world is shrinking, we're more in contact, and at the same time, we're overpopulating, we're expanding into new areas, and we're encountering microbes to which we don't have immunity, to which we're immunologically naive. And this is the problem, and that's how we have to direct it. So here's my so what. Why, before I get there. So these are some of the conventions that came out of this conference. And what I talk about is how certain visual conventions and storylines and popular culture films and phrases and words came out of that, or generally come out of the sciences, but in this case came out of this convention, scientific publications, made their way into the mainstream media and popular fiction and film. And this is really important because you hear certain phrases repeated over and over again, like microbial warfare, which is in every scientific publication. And you think, oh, well, that doesn't mean anything. We all know that's just a metaphor. But in fact, it contains a lot of assumptions that involve how people think about this problem. And when it gets into especially popular fiction and film, that kind of metaphor gets amplified into an extended scenario, a plot, a storyline that becomes conventional. And you can really see what the assumptions are, but these things also form people's opinion of what the problem is and what we should do about it. So why do I think this is so important? Margaret Chan, in the 30th anniversary of Alma-Ata, made that the theme of the World Health Organization. And she said, you know, obviously addressing things like global poverty and thinking about universal access to healthcare is first and foremost a humanitarian issue. But it's more than that. It's also a medical issue because global poverty is the biggest single vector that turns an outbreak into a pandemic. So it affects everybody. And at the same time, let's even talk about costs. If we address global poverty now, which the UN Development Millennial Goals for all their problems shows that we actually can do, it's actually going to be a lot less expensive than when we wait till the next major pandemic, both in cost, obviously, of human lives, but also even financially. So on every level, this makes sense. Why aren't we doing it? And part of my argument is the outbreak narrative. That can help us see why we're thinking in certain ways about these problems, which are helpful, but we're not thinking in bigger and broader and more creative ways. So what is the outbreak narrative? And so again, I don't have time to read all the quotations, and these are just a small sampling, but in each case I'm taking quotations from the science and showing how it got into mainstream media, and popular fiction and film. The outbreak narrative, as I said, is apocalyptic. It's a species-threatening event. It involves the interdependence, the way we're all connected, and also there's a geography of disease. The pathology always comes from the global south. The expertise goes from the global north to the global south. So the threat is coming out of Africa and Asia and affecting the US, Europe, Canada, and so on in these stories. There's a pathologizing of space, or a further pathologizing of spaces that are already pathologized. There is that thing I talked about, microbial warfare, and Joshua Lederberg, who was one of the organizers of the 1989 conference, said, you know, human beings don't really want to think about nature as being indifferent to us. They don't want to think about these like viruses and microbes may in fact threaten humanity. We'd much rather see them as a worthy foe, as wanting to come after us. And so there's this notion of microbial warfare, human beings versus the microbes, that gets really blown up. And in the most extreme scenarios, there's literally a virus that takes control of the host and actually begins intentionally to seed these epidemics. So you get the sense of human beings versus the microbe. And there are metaphors that I think are really important to pay attention to, like consistently, another unwelcome immigrant is Sol virus, a cousin of Asian Hantan virus, which causes hemorrhagic fever. Since 9/11, terrorists rather than immigrants are the favored metaphor, secret agents that shadow ecological change everywhere, nature's undercover operatives hijacking the cell's metabolic machinery, and so on. And these form what I call metaphor exchanges, where we begin to pathologize, and Professor Markel talked about this as well. We pathologize certain communities. Think about HIV, the Haitians, hemophiliacs, homosexuals, and so on, by behavior, by nationality, but also generally immigrants, and of course terrorists is something different, but nonetheless. It makes us also think differently about the microbes themselves, and it influences financing, it influences how we think about these problems and how we treat them. Once you've established this kind of animation for the microbe, there's a really interesting phenomenon, and it actually happens in the science and the nonfiction as well, not just the fiction, where the microbe gets a kind of mystique. So Richard Preston in The Hot Zone, which is one of the early texts that I call an outbreak narrative, it was also the inspiration for the Wolfgang Peterson 1995 film Outbreak, where I get the term. So he talks about a scientist who was looking at the Ebola virus and says, you know, these microbes were the face of nature herself, the obscene goddess revealed naked. This life form was breathtakingly beautiful. As he stared at it, he found himself being pulled out of the human world into a world where moral boundaries blur and finally dissolve completely. And again, I think it's really important to think about the mystique of contagion and not just the anxiety. 5 minutes, okay. Once you've got the mystique of the microbe, it's very easy for it to pick up the sense of an incarnated, offended Earth that's trying to get rid of humanity. Very typical in the science, our Earth is in fact a progressively immunocompromised ecosystem, and that gets picked up into the biosphere may not like the idea of 5 billion humans, or perhaps the human species is just so much meat that cannot defend itself against a life form that might want to consume it. The Earth's immune system, so to speak, has recognized the presence of the human species and is starting to kick in. And the final stage is the scientist as expert, scientist, epidemiologist, medical professional as expert and hero, doing battle with the microbes for the fate of humanity. And if you think about the 1989 message and the 1978 message, you can't just think about this as a medical and scientific problem. Here's where the problem comes in with the outbreak narrative. They do think about it as a scientific and medical problem. Don't worry, medical science has this, they're gonna save the day. My last example, which I'll do really quickly, is from actually how does this manifest in journalism? So in a May 2003 special issue of Newsweek on SARS, we saw this article, these were on a facing pages with the caption linking them. Fear of SARS prompts a Lufthansa crew to wear masks in the Hong Kong airport. The virus may have been born on a farm like the one above in Guangzhou, China, where animals and people live close together. The article tells us that these coronaviruses come from Guangdong, which delivers new flu viruses to the world most years. Pigs, ducks, chickens, and people live cheek by jowl on the district's primitive farm, exchanging flu and cold germs so rapidly a single pig can easily incubate human and avian viruses simultaneously. Guangzhou is a teeming city that mixes people, animals, and microbes from the countryside with travelers from around the world. You could hardly design a better system for turning small outbreaks into big ones. Now, how does this work? Here's the geography of disease. The disease goes from the global south to the global north. Expertise goes in the other direction. This is described as primitive, people living cheek by jowl with their farms, pathologized. In fact, it's an image of poverty, which is not a problem that originates in the global south, but is in fact a global problem that often, as Paul Farmer tells us, originates in the north. And ultimately, this is described as a problem medical science will solve, not a problem we have to think about in social and geopolitical terms. So it perfectly fits this outbreak narrative. I will go to the last slide, except to tell you that avian flu is picking up all of these metaphors, our predictions. So what story do we want to tell? Do we want to tell the story of scientists versus monstrous microbes doing battle for the fate of humanity, which is a story about crisis and survival for which the only solutions are quarantine, vaccine, and pharmaceuticals? Well and good in the midst of a pandemic, but what if we broaden our scope and think more creatively about what this problem is? Then we tell the story not of crisis and survival, but of how we want to live in a global world. And this is a story about human beings acknowledging social responsibility for the world in which we all live together. A story about transformation, not about crisis and survival. I don't know about you, that's the story I want to be telling. Thank you.
Well, good morning, everyone. It's a real pleasure to be here. Let me begin by reading a deathbed account of the Spanish flu. And I apologize for those of you who were at the event last night. I think you will recognize this, but for folks who weren't there, I will offer it quickly. Ben, and that's Ben in the picture here, Ben's long, thin body lay 3/4 covered by the bedding. Its gaunt outline was bitterly twisted below the covers in an attitude of struggle and torture. It seemed not to belong to him. It was somehow distorted and detached, as if it belonged to a beheaded criminal. And the sallow yellow of his face had turned gray. Out of this granite tint of death, lit by 2 red flags of fever, the stiff furs of a 3-day beard was growing. The beard was somehow horrible. It recalled the corrupt vitality of hair, which can grow from a rotting corpse. And Ben's thin lips were lifted in a constant grimace of torture and strangulation. Above his white, somehow dead-looking teeth, as inch by inch he gasped a thread of air into his lungs. It was monstrous. It was brutal. Well, that's how UNC alumnus Thomas Wolfe described the death of his brother in October 1918. The first case of the Spanish flu in North Carolina, the disease arrived in September, about mid-September, in Wilmington, where the city's port linked it to the movement of troops and materiel around the globe, and in turn, of course, linked local residents to the deadly H1N1 virus. And from there, this flu spread very quickly along rail networks, so that within a matter of weeks, it had made its way all the way to remote areas of western North Carolina. At the pandemic's height, in the autumn of 1918, early winter of 1919, more than 520,000 North Carolinians fell ill. That was about 20% of the state's population. And of that number, 13,654, that's about 0.26, so about 2.5%, died. And this flu pandemic, when it hit this state, it hit a state that was woefully unprepared for a health crisis. North Carolina lawmakers had established a state board of health back in 1877, but the first county board of health wasn't created until 1911. And so state officials had very few tools, very few resources for managing the pandemic. On October the 3rd, they issued a bulletin that was reprinted in newspapers all across North Carolina that tried to explain how the flu was spread. They described it as being spread by what they called spit swapping. And they advised readers to avoid large gatherings where they said, people, you're easily caught up in a kind of socially contagious, or as they put it, psychic waves of coughing. You cough, I cough, the next person coughs, and we're all infected. They also urged readers to be particularly wary of the local soda fountain, where the bulletin explained the spit germs of a town are pooled and redistributed. There's a wonderful Coca-Cola ad from this time period where they try to assure, well, that may happen at the soda fountain, but if you buy the bottle, it's sanitary. 2 days later, on October the 5th, the State Board of Health ordered the closure of schools all across North Carolina and imposed a ban on public meetings, including church services. And in many towns, local authorities went even further and demanded that all but essential businesses, say drugstores, grocers, that all other businesses either close or limit their hours and even limit the number of customers who were allowed to enter their doors at any given time, trying to hold down contagion. Health officials also turned to the sort of visual techniques of World War I propaganda as a way to educate the public about the spread of the flu. They distributed posters like these that used evocative images to convey the scale of the crisis and to teach basic principles of infection control, cough etiquette, hand washing, social distancing. And this is a wonderful one really focused on North Carolina. You may not be able to read it from there, but the top, this is how the Germans kill in Europe, and this is how North Carolinians kill by not attending to cough etiquette. The Robinsonian, a newspaper published in southeastern North Carolina, praised these posters, noting that they exemplified what they called the most modern methods of public health education, which could be easily understood by the plainest citizen. Now, as the flu raced across the state, medical facilities and health personnel were very quickly overwhelmed. Hospitals, and there were very few of them. Some examples here, this is Wantz Hospital in Durham, and there's the hospital at the top in Oxford, North Carolina. These hospitals, which are already few in number, lacked the beds necessary to care for even the local town populations they served, much less patients from a broader rural hinterland. And so in rural areas, the vast majority of patients suffered and, of course, in many cases died with only the comfort that neighbors and kin could provide. Black North Carolinians, most of whom lived and worked as sharecroppers and tenants, lived in dire poverty. These are people whose health is fragile under the best of circumstances, suffered particularly heavily in this pandemic. Whites in North Carolina died at the rate of 286 per 100,000. The rate for black North Carolinians was 413 per 100,000, so about 1.5 times. And the scenes that rural health nurses, like these women here in Salisbury, came upon when they went into people's homes were sometimes quite horrific. They reported on more than one occasion entering a home in which every member of the family was ill and there were corpses lying about, awaiting burial. The Watauga Democrat published a tragic story of this kind of experience in the tiny mountain hamlet of Sands, where the health workers went in, the entire family was ill. The wife had just died. She left behind an infant 24 hours old, And then, as the paper put it, her youngest son joined her in the spirit world. Luckily, when the nurses arrived, the infant was in the care of a neighbor, a woman named Wilbur Brown, and others in the family. They were improving. Now, so across the state, there really is no public health infrastructure. There's no workforce. So what authorities did is they turned to home demonstration agents. Women home demonstration agents. The home demonstration program had been set up in 1911 with federal money, and women like these, they were involved in 74 of the state's 100 counties at the time of the flu pandemic. And they had been working with girls to teach them gardening and canning. They had been helping farm women develop co-ops to sell eggs and butter. They had taught lessons in sanitation and hygiene. They were big promoters of sanitary privies as a way of trying to wipe out hookworm infection. And so, in a way, you had a public health force there in waiting. And so what state authorities did is they tapped these women, and these home demonstration agents, in turn, organized sort of ad hoc voluntary nursing corps. The best estimate we have is about 250,000 women were involved in home demonstration work. So, here again, a resource, really the only public health resource the state had. They mobilized quickly. And these women marshaled their neighbors to feed and care for the sick. The work done up in Buncombe County, I think, was typical of other areas around the state. Here's what a local agent reported. I rise at 7 o'clock in the morning and go down to the soup kitchen and remain there until 7:30 at night. We have the kitchen going with a complete card system of delivery, she says. When a call comes in, a written order is sent down to the kitchen. Our women pack a basket, filling it with food. It's put on a dumbwaiter, and it goes up to a long line of volunteers who are there with their automobiles, ready to take the baskets to the designated address. And she says in each case, in each basket, goes a printed card of information regarding the feeding of influenza patients, and they in turn keep a card index of everyone they have served. I think you can begin to see where this is going. This card system that she's described turned out to be an invaluable source and mechanism for collecting epidemiological data in order to be able to track the spread of the disease and to calculate morbidity and mortality. Now, in African American communities, teachers like Annie Weeks here in Wilson County organized themselves in the same fashion. And they did so at, considerable personal risk. And this required some courage as well as a sense of civic responsibility. And like their white counterparts, they went into homes, bathed and dressed patients, fed the sick, attended to their needs as best they could. Now, by November 1919, the worst of the pandemic was over in North Carolina. And as the number of new cases began to decline, public attention to the disease did the same thing. And I have to confess that this came as a real surprise to me when I started looking at the history of the pandemic in North Carolina. I expected that the trauma from illness and death on this scale would linger, that it would persist, and the limited historical scholarship we have, and it is quite limited, suggested that in North Carolina and elsewhere, this pandemic became a kind of turning point, a tipping point in public health policy and investment. Well, so I go into the historical record, and I can find almost no evidence to support either supposition. By the mid-1920s, only 25 counties in this state had a board of health with full-time staff. By the end of the 1920s, there were fewer hospitals in North Carolina than in 1918, and that's going to get even worse in the Depression years to follow. In 1940, North Carolina only has half of the number of beds per capita recommended by the AMA. So all of that begs an obvious question: why? Right? We would assume that this would be a turning point experience, but it doesn't seem to have been so. And let me offer a couple of answers to that question of why. The first, I think, has to do with the nature of the pandemic. The flu arrived swiftly. It inflicted horrible suffering. It undercut nearly every aspect of normal life, and then in the scope of about 8 to 12 weeks, was gone. So the Spanish flu, unlike other pandemic diseases, that come readily to mind, HIV/AIDS in our time or the plague in medieval Europe, it didn't persist as a recurring source of illness and economic and social disruption. The stories of suffering certainly endured in families. They were handed down from generation to generation. But in the moment, they seem to have had very little impact on policymaking or investment in public health. And I think what's going on here, and this, in a way, I think connects to what Professor Wald was suggesting about outbreak narrative, is that authorities seem to have shared this view from the chief health officer in Richmond, Virginia, who observed that no amount of forethought could have prepared us for this tidal wave of disease and death. So the pandemic flu came to be perceived as so catastrophic, or too catastrophic, to anticipate or plan for, even with the benefit of hindsight, of having lived through that health crisis. And we should also keep in mind, I think, that while the flu took an unprecedented number of lives within a very short period of time, it did its work against a backdrop of seemingly intractable sickness and death. In any given year in the 1920s, endemic diseases, tuberculosis, diarrhea and enteritis, diphtheria, typhoid, the nutritional disease pellagra, together they killed more than 5,000 North Carolinians a year. So in a way that I think is a little hard for us to fully comprehend today, death was a constant presence among the living. And so what happens then, this is not just North Carolina or the South, but really what happens nationally is that the pandemic flu of 1918-1919 becomes, as a number of historians have said in the titles of their books, becomes America's forgotten epidemic. And at least in historical terms, it's not rediscovered until the 1990s. And if you think about the timing, that makes perfect sense, right? Because what historians were beginning to do in the 90s is look back to the history of disease from the perspective of a society that was struggling to understand a new pathogen, HIV, that seemed to come out of nowhere and to inflict suffering and death on a global scale. Historians make discoveries that way, right? Not just immersing ourselves in the archives, but often with the perspective of the present cast back to the future, and you begin to see new things. And so it's really in the midst of the AIDS crisis that Spanish flu is rediscovered historically. Well, let me leave it there, particularly so we'll have a little bit of time, I think, for questions and conversations. Thank you very much.